Imagine, you have been chosen. You are going to Mars. The years of dedication and hard work have finally paid off. You launch into space with your fellow astronauts, full of excitement, trepidation, and pride. Then, a month into your mission, you fall and suffer a bad cut. You search in vain for a simple, painless solution to heal your wound, but in the end, the rest of the crew hold you down while one of them staples your wound shut. The next day, your captain pulls out the staples and replaces them with stitches. Local anaesthetic is not an option, and tissue glue is definitely not a good idea in zero gravity. Your wound is painful. It will take weeks to heal, and you will likely be left with a bad scar.
But what if we could heal wounds in days rather than weeks, without stitches, staples or glue, and with minimal scars? Hi, I'm Dr. Rosemary Craig, Rural GP, Innovator and Chief Technology Officer of Rapair Medical Devices, based in the beautiful Northern Rivers of New South Wales, Australia. Our team of award-winning doctors and postdoctoral researchers have developed technology to rapidly repair damaged skin. In fact, in a human clinical trial of excision wounds, where we treated half the wound with rapid repair and the other half with a control, we were able to remove stitches from the treated side within 24 hours. Normally, these stitches need to stay in for about 10 to 14 days. Photos from our trial were reviewed by a panel of 17 experienced clinicians, including surgeons, dermatologists, and general practitioners. They estimated the age of the one-day-old wounds treated with rapid repair as more than 8 days old. Here is another image of a wound from our clinical trial taken a year after treatment. The left side of the wound was treated with the control dressing. The right side was treated with rapid repair. You can clearly see the difference in scar outcomes. These microscopy images are from our current clinical trials with the University of Queensland. The images are a cross-section of the dermis after an incision from the same animal taken at the same stage of healing. The section on the left was treated with conventional stitches. The section on the right was treated with rapid repair. You can see an increased density and much better alignment of the collagen network in the wound treated with rapid repair. While initially we developed this technology to reduce the pain and trauma of wound treatment on Earth, our team was selected by NASA to participate in the 2020 NASA iTech competition, where a team of NASA's Centre Chief Technologists and space industry specialists evaluate emerging technologies from around the world that may be of use in future NASA missions. We felt honoured just to be selected, and even more so when we won the competition, beating over 70 technology companies from around the world. We are now in discussions with NASA with an aim to have our wound dressing technology included on the Artemis missions and for our wound dressings to heal the first humans to set foot on Mars. Well, probably the first humans to fall over and cut themselves on Mars. But before we go too far into the future, let's go back and look at how and why this technology was developed.
The problems with wound repair.
Wound repair hasn't changed much since the Egyptians started stitching skin closed over 3,500 years ago. Current methods, including stitches, staples and glues, follow the same ancient principle of simply holding the edges of the wound together until the skin heals itself. These methods are painful and traumatic, as I'm sure many of you know. They require training and skill to apply, the wounds take weeks to heal, and 10% of patients are left with a bad scar that can impact mobility and have lifelong effects on their physical and mental well-being. Our rapid repair wound dressing is a major innovation. It is easy and painless to apply. No local anaesthetic is required. It can be used instead of stitches, staples and glues. It is lightweight, non-invasive, non-toxic and has a shelf life of over 10 years. More recent innovations in wound care aim at improving the actions of cells within damaged tissue. Our technology is different, as it works on a much smaller scale by targeting the alignment of molecules between the cells.
How rapid repair works.
Skin has 3 main layers. The outside layer is the epidermis. Below that is the dermis, and below the dermis is subcutaneous fat. The dermis consists primarily of the extracellular matrix, made up of collagen, proteoglycans, and other molecules. Healthy skin regenerates by the new collagen and proteoglycan molecules aligning and attaching to the existing matrix. When skin is damaged, the matrix is disrupted, and the collagen and other molecules flowing into the wound are unable to align properly. Over 4,000 collagen molecules need to align with each other to bridge a 1 millimetre gap. The rapid repair wound dressing is designed to realign the extracellular matrix of the dermis in damaged skin. Our dressing contains structures which project an electromagnetic virtual scaffold into the wound. This virtual scaffold imitates physical properties of an intact matrix, so the molecules flowing into the wound can align as they would in undamaged skin. This produces an efficient repair within hours instead of weeks, as the virtual scaffold guides each molecule to align and bond into a strong matrix during hemostasis, the earliest stage of wound repair. This decreases the need to upregulate fibroblast metabolism, since the repair is already achieved with minimal quantities of collagen and glycoproteins. This also decreases the need for an inflammatory reaction to remove debris from the wound, as it has not been opened long enough for bacterial contaminants to colonise or infect the wound. And the blood clot is a vastly improved structure which doesn't need to be replaced by a stronger matrix to hold the skin closed. This decreased need to remodel the repair is because the molecules are already set into position with maximal tensile strength that also permits the skin to be pliable. The dermis can seal within hours. The keratinocytes can then seal the epidermis across the defect within days. Because we make a massive difference to the smallest parts, which make up the biggest volume and the slowest aspect of repair, everything else falls into place. This reduces healing time by over 90% and produces a minimal scar.
The origins of rapid repair.
I developed the technology within the rapid repair wound dressing after decades working in hospitals and clinics, treating a range of accidental and surgical wounds. I found that often the pain and trauma of wound treatment was as bad, if not worse, than the original trauma of the wound. This was particularly true in children who often had to be restrained while local anaesthetic was administered and the wound stitched closed. There had to be a better way. After many years of research into how the body heals, I identified the bottlenecks in wound healing and how to potentially overcome them. This led to the creation of the first rapid repair prototype. I commenced clinical trials at the Southern Cross University, and this research was recognised by the Australian Government's Peak Research Institution, the CSIRO, who have worked with me and my team to commercialise this technology and make rapid repair the gold standard in wound repair on Earth and beyond. I must admit, though, that the technology within rapid repair is not just the result of science fact, but also science fiction. In particular, Star Trek. I have liked Star Trek for a long time, longer than I have been a doctor. And as a doctor, I'm still impressed by how they do their medicine in space. In Star Trek, the doctors can make rapid, precise diagnoses. They do amazing treatments with great clinical outcomes. They appear to have minimal equipment and they have cool uniforms. They also never use stitches. I realised that if we were ever going to get to that future, we needed to start now. And while in the future we may have massive starships with hundreds of crew and unlimited supplies, the realities are very different for our space pioneers taking the first tentative steps away from Earth into our solar system. So let's look at the challenges of treating wounds in space. One of the problems of doing wound treatments in space arises from the limitations of a frontier environment, where there is limited space to store equipment within a habitable zone and extremely challenging conditions outside the habitable zone. It is more efficient to have smaller, fewer items which can do more and have the few small items which remove the need to use larger, bulkier items. The rapid repair wound dressing is a flexible polymer strip which can be rolled. It can be stored in extreme cold or extreme heat. It can be stored in zero gravity and zero atmosphere. It is not damaged by water nor a lack of water. It doesn't have to be sterile, and it removes the need to have the surgical equipment to apply stitches, staples or glue to close skin wounds. It is very stable and has a very long shelf life, which appears to be well over 10 years, but possibly much more. Another problem in space is that there are limited personnel to use the medical equipment. Many of the team members are needed for their expertise in non-medical roles. Ideal equipment would be easy to use with minimal training so that the team can treat themselves. The rapid repair wound dressing is very simple to use. The edges of the skin wound need to be taped closed, like with butterfly sutures or a surgical tape, and then the rapid repair wound dressing is bandaged or taped into place for about 24 hours. The first time I tested this innovation, it was on a deep cut on my own face. I needed stitches. I was a long way from the nearest doctor. That wasn't me. And I wasn't keen on the idea of having stitches on my face anyway, as I was very likely to get a bad scar. I have to say that there was no sensation associated with using the rapid repair wound dressing. It was very easy to apply, and I'm not sure if anyone here can identify where the scar is, although it is over 4 centimetres long.
Back to the future.
So, now you know the story of how the rapid repair wound dressing was developed, and why NASA can see the potential benefits of using our wound dressing on future missions. But our wound dressing is just the beginning. The underlying technology within our wound dressing can be modified to rapidly repair almost any type of damaged connective tissue, including ligaments, tendons, and bone. Our team is already planning a range of braces and splints to help rapidly repair these structures within humans, no matter what planet they live on. So, if you would like to know more about our technology, please feel free to contact us. Also reach out if you're interested in entering the NASA iTech competition. We are more than happy to share our experiences. We look forward to helping you all live long and prosper by providing faster, better healing. Thank you.